I've always said I will work with anybody to implement and improve this law effectively. You got good ideas? Bring them to me. Let's go.
Well, President Obama's already signed 6 legislative changes to the health care law into law, but continues to publicly say the critics of the law are not offering up any substantive alternatives. Well, our next guest, Louisiana Republican Congressman Steve Scalise, chair of the Republican Study Committee, has a plan with more than 100 co-sponsors in the House, and he has asked the president for the meeting so they can talk about this. He joins us now live. Congressman, welcome, and have you gotten a response from the White House?
Well, Shannon, good to be with you. And no, unfortunately, we have not gotten any kind of response back. We sent a letter to the president taking him up on his offer. He said, look, there are no alternatives out there, and I'll meet with anybody. And, of course, we've got an alternative. It's called the American Health Care Reform Act, with over 100 co-sponsors of the bill. So we've got medical doctors in Congress that help write this bill. It does a lot to put patients back in charge of health care, to lower costs, as opposed to what we're seeing with the president's approach that's raising costs and taking people's health care away. So it's a good bill that we're proud of. We'd love to sit down with the president and go through with him how we can actually put patients back in charge and fulfill those promises that he made to so many people that have been broken time and time again.
Well, I hear these conversations and I'm part of these conversations all the time, and people say this line that the president continues to say, that all the GOP wants to do is repeal the entire bill. He said it himself, go back to the status quo before any kind of reform. And he said that they have, if they have any alternatives, they sure haven't presented them. And people, a lot of folks out there believe that you haven't presented an alternative. So content aside, how do you get any traction with this message? How do you get that meeting?